Having your PICC line put in. This animation shows how a PICC line is put in. You may have a PICC line put in when you have cancer treatment. A PICC line is a long, thin, flexible tube. It is inserted into one of the large veins of the arm near the bend of the elbow. It's used to give fluids and medicines like chemotherapy and drugs. It can also be used to take blood. Having a PICC line means you don't need to have repeated injections or needles. Once it's been put in, it can stay in for weeks or months. It can stay in until all your treatment is over. The PICC line is put in by a specialist nurse or doctor in hospital. First, the skin in the area is cleaned. Then the area is numbed with an anaesthetic cream or injection. This is so you don't feel pain while the PICC line is being put in. When the skin is completely numb, a needle will be inserted into a large vein in your arm. The PICC line is threaded through the needle and into the vein. It is then threaded through the vein towards the heart. The needle can then be removed, leaving the PICC line in place. You will then have a chest X-ray to check that the end of the tube is in the right place. The end of the line comes out above the bend of the elbow. The PICC line will be held in place by a dressing. Having a PICC line put in shouldn't hurt because of the local anaesthetic, but it may be slightly uncomfortable. At the end of the PICC line is a needleless connector. The nurses will use this for everything they give you through your PICC line and for taking blood. Before you go home, the nurses will show you how to look after your PICC line. Most people don't have any serious problems with their PICC line, but they can sometimes get blocked or infected. If you have any questions about your PICC line, ask your doctor or nurse. For information, support, or just someone to talk to, call the Macmillan support line on 0808 808 0000 or visit macmillan.org.uk.